We're going to start this meeting. This is a webinar for young physicians guidance who are interested in pursuing a postgraduate training in United States and Canada. Most relevant is to USA. My name is Zina Saftar. I'm the president of Jinasin Medical University Alumni Association of North America. Basically, we are the alumni that graduated for JSMU, formerly known as SMC, and now practice and work in America, United States. So this seminar is to help guide the young physicians and students who are interested in participating and pursuing their postgraduate training here. So we have a great program outlined here in which we have the pleasure of having Ms. Elizabeth Ingram, who is the director of Ecfmg, to give an update of how things are going. A few housekeeping rules which are outlined here, that all your posts, all your questions that you have, there's a chat box function in this Zoom meeting this morning, and you can post all those questions there. A moderator is going to be Nasir Rashid. He's going to get all those questions and ask and pool them together and answer those questions and address those questions during this presentation. The program is outlined here. We have a program director joining, Dr. Mujib Shah. Educational activities is going to be outlined by Dr. Rizwan Naeem, how COVID has affected our lives, including, match and ECFMG application process. Bilawal Ahmed is going to talk about graduates, pearls for the recent graduates. I will review some interviewing tips in this era of Zoom meetings, and session is going to be moderated by Nasir Rashid, and question and answer session is going to be moderated by Dr. Naqmana Shafi. So it's a pleasure to have you with us. Without further ado, I'll ask Dr. Ms. Elizabeth Ingram to go over her slides and presentation.
So good morning, everybody here in the United States, and good evening in Pakistan. Good afternoon, if it is afternoon where you are. It is a complete pleasure to have a bit of your time this morning and to talk to you as you pursue ECFMG certification and graduate medical education in the United States. I'm going to give a quick overview of a few topics this morning, and then I'll be available for your questions later. I'm going to talk about the critical importance of IMGs in the U.S. physician workforce, some of the challenges that, from the ECFMG perspective, that we've seen resulting from COVID-19. I'm going to talk about probably the two most relevant programs for you, ECFMG certification and ECFMG J1 visa sponsorship. And then I'm going to highlight a few of the resources that may be helpful to you as you continue on in your pursuit of a residency. So first, a little bit about IMGs in the U.S. physician workforce. This could be a topic that we would spend the entire presentation on this morning, but I'm going to give you a quick overview. Based on information that was current at the end of 2018, there are just over 1 million active physicians in the United States. And by active physicians, I mean all major professional activities, including residents and fellows, but also including office and hospital-based practice, medical teaching, administration, and research. And a full 25% of those, or more than 250,000, are international medical graduates. That is, those physicians who received their medical education outside the United States and Canada. Of those 25%, 3/4 are foreign nationals, not citizens of the United States. So the numbers are significant. As far as country of medical school, India traditionally has been the largest sending country for the ECFMG certification program and for US graduate medical education. However, Pakistan has always been in the top 5. And as you can see, over the last 10 years, the number of Pakistani physicians pursuing ECFMG certification has been trending upward. Zeroing in on individuals who were citizens of Pakistan at the time they entered medical school, there are about 15,000 of those individuals in the United States currently. And that represents a 32% increase, those little increase in the bars that we saw on the last slide, over the decade from 2008 to 2018. About 2/3 of them are male, 13% are residents, and 43%, a pretty big proportion, are in primary care specialties. So the internal medicine, family medicine, pediatrics, those frontline providers. And the contributions of IMGs in the United States are many. Our healthcare system would not function without international medical graduates. In a country like the United States that does not produce enough physicians to meet its healthcare needs, the contributions of IMGs and the fact that they come here to train and many stay to practice ensures an adequate physician workforce. Many serve in underserved areas, and those are both rural and urban in the United States. As we saw on the prior slide, they make greater contributions to primary care than their US citizen counterparts. They add much needed diversity to the physician workforce here in a country where our population is becoming more and more diverse. And they also enrich the clinical learning environment while in graduate medical education and the practice environment ultimately with their international perspectives and experience. There are challenges for international medical graduates, particularly foreign national international medical graduates that have been presented by COVID-19. I'm sure we're going to hear about many of those challenges from different perspectives today. I'm going to highlight just a couple. The suspension of USMLE testing around the world certainly was a very big challenge. And the suspension of USMLE Step 2 CS, which continues, and will continue at least through mid-2021, is certainly a challenge. There were immigration changes related to COVID-19 intended to stop the spread of the disease. There were travel restrictions, the ability to get on a flight and come to the United States for those individuals who matched in March and who had start dates in July of this year. And as I said, there were many, many others. But for us at Ecfmg and Ecfmg FAMR, we really were committed to making sure that the Ecfmg certification process continued to serve its function, and that there was continued entry of qualified IMGs to USGME. And that affected our Ecfmg certification program, the first program I'm going to talk about today. In the past recent years, maybe about 5 years, we've certified about 9,500 international medical graduates every year. That number was just about 9,500 in 2019. In 2019, the last year for which we have complete data, about 600 or 6.3% were citizens of Pakistan at the time they started medical school. Another program that I believe you're all familiar with or should be is ERA Support Services at Ecfmg. The Association of American Medical Colleges has designated Ecfmg as the Dean's Office, and I'm using air quotes, for international medical graduates who want to use ERAS to apply for first year and second year positions in USGME. And we do serve between 20 and 21,000 IMGs every year in that process. Of course, that process is now open for 2021 positions. Ecfmg is also designated by the US Department of State as the sole sponsor of the J1 visa for physicians, foreign physicians in US clinical training programs. We are the only sponsor for the J1 visa, which is the most common visa classification for foreign national physicians engaging in US graduate medical education in the United States. And in 2019, the last full year for which we have data, there were well over 11,000 physicians who were nearly 12,000 physicians that we sponsored for the J1 visa, and that's at clinical training programs all over the United States, basically every state and some territories. Nearly 10% of those were citizens of Pakistan. Our certification verification service is the service that you and your program and licensing boards eventually can use to verify with us the primary source that you're certified. Okay. So the program has operated continuously for about 70 years. We do set the requirements and determine which exams meet those requirements. And this year that has been particularly important because we are grappling with the absence of Step 2 CS. Those are requirements and exams have changed over time. And in response to the absence of Step 2 CS, we have developed new pathways that will allow international medical graduates to demonstrate their clinical skills and their English language proficiency so that they can continue on and participate in the 2021 match, become certified, and enter graduate medical education in 2021. I am not going to go over all this detail. This detail is on the Ecfmg website, but it will give you a flavor of what the pathways are. There are pathways for individuals who are already licensed to practice in another country and were licensed recently, all the way through students and graduates whose school participates in the U.S. federal student loan program. Regardless of which pathway you pursue, Ecfmg is requiring for the 2021 match a passing performance on the Occupational English Test Medicine. It is required for all IMGs pursuing a pathway, regardless of whether you're a native speaker of English, whether the language of instruction at your medical school is English. It is designed specifically for physicians, has 4 measured components, and the score must be for an examination on or after July 1, 2018. And the deadline for taking the OET medicine this year to complete your pathway, if you're pursuing a pathway, is December 31, 2020. And that will enable us to evaluate your eligibility for the pathway and to report your status to the NRMP by the rank order list deadline, which is March 3 this year. And again, thinking about the pathway plus OET, that is only for individuals who do not have a passing performance on Step 2 CS. So in this match, we will have individuals who pass Step 2 CS before the suspension, and we will have individuals who satisfy the clinical skills and English language proficiency requirements with the pathways. Talking a little bit about Ecfmg J1 visa sponsorship, the program continues to grow. As you can see nicely in this chart, there has been a 62% increase over the past decade, from 2009 to 2019, in the number of individuals we're sponsoring. So J1 physicians are a larger proportion of trainees and of the supervised physician care workforce. Top 10 states for Pakistani physicians training in Ecfmg sponsored J1 visa status. By far, New York, the state of New York, is the most popular. Michigan, Pennsylvania, Texas. You can see that many of these states are states that have been hardest hit by COVID-19. So the contributions are especially critical in those states. And during the past year, we have addressed some of those immigration challenges, travel restrictions as they have come up. We kept in close contact with the Department of State and with training programs. We did 2 surveys earlier this year of training programs to see what their challenges were in making sure that their J1 trainees arrived. We did engage in advocacy with national and local media to raise awareness about the importance of IMGs and to make sure that everybody knew that the foreign national physicians, and there were 4,222 of them who matched in March, make sure that they got to their US training programs. We also collaborated with other US organizations in the medical education and licensure community, and we enhanced our communications with J1 physicians, with programs, and as I said, with partners and the US Department of State. And the results were good. We were able to facilitate the resumption of visa processing earlier this year and the availability of appointments at US consular posts for newly matched physicians. We got the approval from the Department of State after speaking with them to accept electronic statements of needs. That's an important component, that letter from the home country government for the J1 visa application. Very practical issues that we face this year if you are a newly arriving J1 physician in the United States. Before you can work in your program, you need to be assigned a US Social Security number, yet all of those field offices were closed. So we intervened to allow J1 physicians to be determined to be in dire need, again, I'm using air quotes, of a Social Security number. And we're really thrilled to report that by early August, 95% of our first-time J1 physicians had arrived at their programs. That's a number that rivals past years, and we think that's a huge accomplishment in light of the circumstances, so we're just thrilled. I want to talk a little bit about our resources. There are many on the Ecfmg website. If you are an individual who is pursuing USGME currently and you do not have a passing performance on Step 2 CS that is valid for Ecfmg certification, you should already be familiar with the new requirements for certification for the 2021 match. The section of our website that talks about the pathways, the OET medicine, and how to apply. There's a new online application. That's a very robust section of our website, so please take a look at that. We did launch a new newsletter for the U.S. graduate medical education and healthcare community. Everyone is welcome. It's on our website. It's our COVID-19 newsletter. Began in April. We've published 15 issues to date. We publish every 1 to 3 weeks, depending on how much news there is to report about issues facing international medical graduates and foreign national physicians in USGME, pursuing USGME. Raising awareness of the critical role of that Imgs play in our country, identifying those challenges and reporting on the solutions as we're able to accomplish those solutions. So I advise you, invite you to please sign up for the newsletter. The Ecfmg Reporter is another email newsletter. It's long-standing. It's more than 20 years old. As I say many times at these presentations, it's an oldie but a goodie. It's old-fashioned, but we don't waste your time. We don't share your email addresses. We do send information when we have it, and it really is essential program updates on Ecfmg certification, USMLE updates related to certification, entry into USGME. We have a large subscriber base around the world, and you can opt in when you apply for USMLE Step 1 or Step 2, or you can subscribe anytime on the Ecfmg website. Just go to the website and search. Social media, as I've said in past presentations, we have invested a lot in social media in the past few years to make sure that we are distributing our message in a way that reaches as many people as possible. Our Facebook, general Facebook channel is a great channel for individuals pursuing certification and USGME. Twitter channels, we have a general Twitter channel for applicants. We also have one specifically for those J1 physicians already training in the US. So please sign up for Facebook and Twitter. If you are someone who is sponsored by Ecfmg for the J1 physician and you become a J1 trainee, please sign up for J1 Twitter as well. I also want to highlight our Journeys in Medicine blog. This is the newest resource. Now the COVID-19 is newest, but this is the second newest resources that I'm talking about today. This really is a blog, is a forum for and about J1 physicians in the United States. And it is the story of those J1 physicians. It is the story of the programs that host them. And they talk about their experience in GME, what the cultural exchange experience is like. Some of them report on what they were doing after returning home. And some of our more recent blog posts are really about Imgs and their experience in patient care and in dealing with the COVID pandemic here in the United States as they train and as they treat patients. So with that, I'm going to end, and I look forward to your questions. Thank you very much for your time.
Okay, great. Thank you so much, Ingram, for giving such a great presentation.
My pleasure.
So I'm going to move right along and ask Dr. Rizwan Naeem to give us some update on what's happening with the educational activities in COVID.
So good morning, everyone. And first, I wanted to thank you, Elizabeth, and our friend, Dr. Mujibuddin Shad. His name was not Shah, it's SHAD Shad. And he is a program director in psychiatry in Nevada. So, and Nasir Rashid, who is the coordinator for this meeting today. Thank you, all of you, and Zenat for coordinating these things. I see over 80, 90 have already logged on, which is really a great success for all of us. And this is where COVID has provided a lot of difficulties. It has also provided some opportunities. And this is one we are seeing now by reaching out to as many people as we have never would have. So with that said, my presentation is very small, very short. And what I wanted to say is this, that the disruption of learning environment, that is totally true because with social distancing, there is no such opportunity to teach people one-on-one carefully. And again, in hospital, like we have one of the largest hospital in United States where I work, and it's a patient care. Means most of the residents and fellows were really called on to go to duty rather than getting their own training. So there was a big shift from priorities from education to patient care in recent past. And hopefully things have changed and things get better. Then the public health guidelines around PPE and social distances caused all these disruptions, and medical student, medical rotations and undergraduate rotations have been dismissed. I mean, for a certain period of time, we were just not allowed. Still, we are not allowed in different hospitals to have visitors or have medical student even attend rounds and observership. So that has caused great difficulties and changed the learning environment for IMGs especially. Travel restriction nationally and globally, we all know that. Rotation to other hospitals and healthcare setting is suspended for medical students and residents and fellows because many of these training programs, one of like ours, which is a genetic-based training program, no one has ability to train and educate on every aspect of that specialty. So what we had rotations in different hospitals in New York to help training, and that has been disrupted. But as these difficulties, as these challenges and disruption happens, new opportunities comes on also. So now we have Zoom-based and Skype-based and online-based conferences from all over the world and all over the country to be for the training purposes. So as there are difficulties, there are opportunities also. Next slide. Zenith, you have a control or do I have a control? Okay. Then another important thing which I know that is created in past is that there is a coalition comprised of multiple stakeholders, including ACGME and Ecfmg and other organizations, and they have certain recommendations which are relevant to medical students and program directors and programs. So aware rotations are discouraged, as I was saying, that was one recommendation. Second was commit to virtual interviewing and visit for all applicants. So now, as you can see that many hospitals, including ours, majority of hospitals are doing online visits or virtual interviews, which we will talk about that later. And another recommendation was delayed opening of ERAS, which usually happen by now, but just because we don't want it to overload the programs and the students also. So we delayed the ERAS, and interview period is little shorter in this regard. Next slide. So, but there are opportunities also. What has changed? Virtual interviews have changed many things. For example, no travel expenses or time. So it's an equal opportunities to everyone now. I know a lot of FMGs and foreign medical graduates struggle with travel and struggle with finances to go to different programs and interview. And I think this is an opportunity for the brightest and the best ones to, even if I know of residents who really traveled 20 hours of bus travel and came for an interview when I was interviewing last year. So these type of, because he could not take a train ticket, he could not take airplane ticket. So this has given opportunities to many bright and not so fortunate people to be in equal terms and equal opportunity type of thing. So that's a good thing. Programs will interview a greater number of candidates per program. So again, you will have many more choices for residents, and residents have many more choices for programs also. So it will be an interesting period to see how these things evolved. And one thing is we will know after a year or two that how things are going. Greater reliance on virtual information. So at the eye-to-eye contact from residents and program directors is not there. So we'll be relying on videos. So I would say many of you who are potential interview candidates should be very familiar with the online interview processing and Zoom interviews and webinars. A virtual tour, many programs like our also has developed videos for residents for informational video, which is really a virtual interviews and walking tour of different sections of the hospital, different program specialties, and how we deal with it. So there is a lot of different changes. Next. So another important thing for virtual interviews for residents and fellow helpful suggestions are become familiar with all functions of Zoom. Means as we were seeing today, only Irfan Suleiman, our past president, is knowing how to deal with Zoom. But I think this is an important aspect for every candidate and program directors and interviewers also to be familiar with Zoom. Screen share, how you share a screen. Sometime you may have a small presentation. They may ask you, you have to present something as your papers or your project or project highlights. So you need to know how to share your screen with the program director if there is a need for that. Chat box, as we will see today, there are a lot of questions which can be chaotic if you have one-on-one question answer session and it can go long. So you need to know how to coordinate good questions for the program directors or different specialties as you go. There will be breakout rooms, so you may be in a main session with the program director and few interviews. Then you may go into a breakout room with all the residents of the program, and you can chat collectively with that group of residents or group of current residents or group of faculty who might want to talk to you with the area of interest you have. There might be a polling via we are in the program by the interviewers and that what do we think about this? What an instant decision type of polling that where we want to go from here. Then virtual visiting. Some programs are also developing that if you are very serious and a very good candidate, we will invite you to a virtual interview. Visiting means you can go and talk to different attendings of your interest and see what they do and how they do it. And again, a lot of reliance this year will be on social media. And make sure that your social media, if you are in social media, you are with the right name and right decent profile. And because almost every programs now find out what is your social media, what type of thought process you have, what are you writing? Are you asking questions where are inappropriate, for example? I know many of us receive those type of emails that how can I be a part of your paper and how can I do something which may not be very appropriate. So make sure that you practice a good social behavior in social media because every program is looking at you through social media. Next slide. So virtual interviews for residents is a very helpful suggestion during the interview. I think these are very similar to what we have in the past, but I don't think that if you are interviewing, you don't have to dress well. You want to make sure that you are looking sharp, you are fresh, and you are attentive, and your only interest at that time, the people who are in front of you. You're not chatting on your cell phone like I was doing while you were interviewing, because these habits are just not a good. You need to present yourself very differently. So remember this also, when you're interviewing, you're not interviewing only with one person. Your camera might be on for everyone. So make sure that you are attentive all the time. Then also what I would say, the icebreakers. So make a small joke, smile a little bit, and do something nice on screen as to break the ice and make your interviewer very comfortable in asking questions they wanted to ask. Don't be all serious and very what you call nervous. Means you need to talk to people online, especially your seniors if you want to, and ask someone to interview you and see how you perform. Be respectful for the appointment time. I think that's a very critical issue. When you are interviewed for a certain time, make sure you are there 5 minutes early, like you do for in-person interview. And understand time zones also. When you're saying good morning, make sure that the person who is interviewing is in which time zone you are. You don't want to say, good evening to Dr. Mujibuddin Shah, who is in Pacific time coast, and I'm in New York. So it is make sure that you respect the other person who's interviewing you. Comfortable with the small video groups means there will be breakout sessions, will be video group where you can talk to many people together. Short session, reduce Zoom fatigue. Means this is actually for the program directors, because we don't want a 2 hours, 3 hours Zoom session to be, next slide, to Zoom, to fatigue yourself. Not I think the next slide.
I think that's your last slide.
Okay, so I'm available for interview, sorry, for the question answers, but these were my thoughts. Thank you.
Those are great points, and those are very relevant in this day and age, because now we have all the interviews are being conducted via Zoom. All our meetings are being conducted by Zoom, webinar, and all the other different platforms. So I think Dr. Bilawal Ahmed is now going to talk about interviewing skills and tips and suggestions. I think this is your resources, Dr. Rizwan.
Yeah, so I will share this with you. These are resources for everyone that what I could find is available online, and papers printed on how to interview virtually. So the AAMC has a website where you can get many information, and there are 3 or 4 papers which have been published as how to prepare yourself for virtual interviews. So this, Zenith, if you can share this with the audience after the session, that'll be great. This is resources for all the attendees.
Yeah, so we are collecting all the emails. So if everybody can put their emails down in the chat box, so that at the end we can collect all these emails and send out a feedback and also slides for their reference. So Dr. Bilawal Ahmed, he's a recent graduate. He just finished his fellowship and is starting his job as an assistant professor of medicine at University of Tennessee. He's going to talk about pearls for graduates in the current match.
Hello, everyone. I hope you're able to hear me. So I'm a graduate at 2011. So I think I can relate to the young graduates the closest at this point. I just wanted to share 2 slides, and I'll be speaking not more than 3 minutes. One slide is for people who are applying in this match, and I can have my slide next. And then I have a couple of points for people who are thinking to apply when they are or right now are in medical school. So in the current match, this will be an interesting match because no one has any idea about how it will turn out. And I can just give an idea in a way that the fellowship match starts in July. So the fellowship match is almost over, which is after residency. And of course, the residency match is currently underway. So people will start getting interviews. So what happened in fellowship match was people, as Dr. Naeem said, you will get an opportunity to get interviews, and you have to present yourself. But what will happen is people, because they're not seeing you physically, there could be, like I would say, a hindrance in getting interviews for international graduates. So because you're not seeing anyone personally, there could be, I would say, a downside where person who knows someone will be preferred over a person who doesn't know that person. So, like what happened in fellowship is people who are from their residency programs uh, were automatically selected because you would rather hire a person that you know than a person that is sitting like miles away from you and you're not able to see. So this will be some challenge. So what will happen eventually is like a lot of US graduates that I've spoken to, they said like once a US graduate applied, they pretty much apply to like 30 or 40 programs and they get like 20 calls. And what happens is like they don't travel to 20 interviews. They cancel half of their calls and they attend maybe like 7, 8, 10 of the top programs. Now this will not happen this year. What I've spoken to people, they said, hey, why would we cancel interviews when we're not traveling? So it goes both ways. It will save money for you to travel, but it will also save money for other people and for a US graduate to travel. So they will take every opportunity to interview to any place, which means that there could be a potential that an international graduate who used to or who can get a call on a cancellation might not be able to do that. So networking is super important. Knowing people that can help you get an interview, like program directors, assistant program directors, people who are in the academic programs. This is a time where you need to reach out to them, introduce yourself. So this is important. When you follow with someone, be courteous. You know, not everyone will be able to just like get you an interview on a message. And this is a challenge that a lot of us face, that we get a lot of messages and we try to guide them as much as possible. But if I'm getting 20 messages, it's not easy for me to recommend 20 people to the program director or whoever. So be courteous and just try your best and see what happens. Um, Personal statement, one thing I just wanted to comment on personal statement. I think a lot of people have already submitted their personal statement, but what I've seen and what I've done, like I was a chief fellow and I used to review statements before inviting people along with the whole group, including program director. People sometimes write things in personal statement that doesn't sound true. I mean, you present yourself as a superhuman, you present yourself the best person on earth, you present yourself as someone that has capacity to do everything, and that doesn't sound real. And so people who have an opportunity in the future, be real, be personable, be have a story that you can relate to. And no one is judging you to be perfect. They just want you to work with you. You need a good person to work with. They don't want a perfect person. So do not write things in statement which might be true, which might not be true. Sometimes you kind of overdo selling yourself, but do things which look real, and so that a normal person can associate with that, because that's fine. I mean, you don't have to like overdo things. And this is what the art of selling is when you write an email to a program director, because follow-up is super important now in this case. Like you have to reach out to the program directors and the program coordinators, and even after when you complete your virtual interview, it's always good to follow up and leave an email that, hey, I really like the program and this and that and that. But again, you have to have an art of selling yourself, and it needs to look real. We should not overdo it, because people from here, people who have understood and worked with people, they know we can judge or we can tell that, hey, this person is going overboard. And no one likes a person who goes overboard, because like people say, don't be over smart, just be yourself, and be nice, and just follow up and just see what happens. So these were my pearls for current graduates. I can have the next slide. Um, this will be for current medical students. So uh, right now, whoever is in medical school, I hope you guys are joining in. I think you should, if you are planning to come to the United States, not everyone needs to be here. We need people in Pakistan. And some people will have commitment to go to UK. Some people can go to Australia. There are so many opportunities. So if you have made your mind, you have to make your mind early in the course, because now with the graduates and now with the competition, um, if you are few years out of training and if you have not done things in medical school, which are super, I think 80% of the things that you do to get match is done in medical school or as a medical student. So I think you should plan yourself and you should map your timeline really well. And I think you should have your timeline as early as a second year medical school. I have written some things like I think you should get the research part out, get your publications and presentations between the second and fourth year, because this is the time when you are learning about things. When you are new, you have basic science courses, so you can dedicate your time doing research and get some publication. You don't need 1,000 publications. You need 3 publications, 4 publications. So don't go for numbers, go for quality. It might be less, but that's okay. People from US, people who are coming from US medical school, they don't have a lot of researches. So I know you have to stand out, but you don't have to do like 10, 12 publications and then overburden yourself. Uh, Give step 1 at the end of fourth year. And I think you cannot beat steps. Step scores are the most important thing that makes you different from anyone else. So people, what I've seen and what mistakes people do is like they concentrate on research, they concentrate on research electives, and they concentrate on all kind of different things, but they don't concentrate on steps and USMLEs. And USMLEs are the most important thing, the single most important thing that will differentiate you from another candidate, because and it not only residency, it goes to fellowship. So if you apply for competitive fellowships, they filter, even in fellowship, which I was surprised to know that even in fellowships, when you are done with residency and you are graduate from a US institution, even then when you are applying for fellowship, they filter you out based on your scores. Because how would you do it if you have 1,000 applications for 20 spots? So scores are the number one filter that makes a differentiation. So if you're not able to clear that filter, everything else is second, and it's not important. So I would say if you are able to give step 1, and people like from AKU, they have their timelines mapped out and they do give step 1. In the final year, you do US electives, because I think now the great part is GSMU is part of the US affiliation where you can get your electives. And when you go for an elective, get your CS out of the way. And this is what I did 10 years back. So I'm sure people can do it here in this age and era, because you know so much information which we didn't have in our days. And once you graduate and you have step 1, you have step 2 CS, you have your electives, which means you have your LORs in place. Give step 2 CK 3 or 4 months after graduation, and you are all set for the match the same year. So you don't have to waste 2 years after your graduation, and then you are burdened about doing your house job, and you get things that you get carried away with. And again, the last thing is USMLEs are the most important part of your application, and nothing else beats it. So you can have 100 research, but if your USMLE scores are less, unfortunately, you'll be filtered out. So please don't compromise on that. And of course, we'll be taking more questions, and that will be my end. Thank you.
Great points and great presentation. And you're absolutely right. The one thing that screens an application out is your USMLE scores, because what happens is that these applications come in, and the secretary who is triaging the applications, they are given a guideline of a USMLE score. And that guideline is very strict. So your application will not move forward if the USMLE scores are not within what that program wants. So scores are very important. I totally agree. I'll just go over a few tips for the interviewing. Yeah, I totally agree with the personal statement. It has to be great. I think most of the personal statements have gone in already, but for next year, your personal statement should tell a story. It should tell the other person reading it why you want to be a physician, why do you want to pursue post-grad education in why medicine. So it would reflect who you are. It would have some personal story or some personal connection with the reader. So I read a lot of personal statements, and the one that stick out with me is those which don't have any errors, and those that tell good give me an idea about the applicant. So these are just pointers that I'm not going to go over too much, but have already been talked about. Your ability to communicate, especially in this day and age, is very important, especially if you're going to be doing a interview, which is going to be a web-based interview, and you need to show why they should get you, but why they need to have you in their program. So, and if you're writing something in your personal statement and somebody asks you about it, you should remember that, because one of the applicant told me, oh, it was so long ago, I don't remember. Well, that's not the right answer. You need to be able to say what you wrote and why you wrote it. So back it up, and you should be able to tell a case if they ask you for an interesting case. And that can be anything from your house job, from your med school, from your observership. And this is the POWER formula that most people like. State the problem, describe what you did to solve it, and the reasons why you did it, and how did it help. And it has to be not a story of somebody else, it has to be your story. And then do your homework. Even in this, you can go online and review a lot of things about that program, about their history of the program, about their, what do they like, what residents they take, what the residents end up doing, what is the city like, and things like that. So please do your homework. So just still, even if for a distant interview, still these things apply. Know the city, the hospital, the program director. You need to know, like one of the, when I was interviewing, one of the applicants came to me and had already read a few of my publications and said, okay, I like that paper of yours really well. So that really stuck with me, because that person really took interest in knowing about the program director and the faculty. And be ready to have a list of questions that are, that reflects that you have done your homework. So these are just, again, the body language is very important, especially if you're doing an interview, which is web-based. You need to be sitting up straight and making eye contact, and be courteous, all the things that were already mentioned. And be ready to answer the question, what is your weakness and how did you overcome it? That's an important point. And very formal. It's a formal interview. Just take it very formally. As I said, make eye contact, sit up. Don't, these are just important points. Just be natural, be confident. These are very easy to write down, but difficult to do. So maybe you want to record an interview that you did with a friend and see how you come across, so that you can improve yourself. And then after the interview, just see how you did, what is your own feedback for that interview, and then send a thank you note. That is very important. That really is going to go a long way to help you. And that's just a quick presentation on the tips, and we will be sharing the slides with you if you were to give us your email address at the end of this. And then I'm going to open this up for question and answer session. And I think Nahmana is going to be, Dr. Shafi, Nahmana Shafi is going to be moderating that session.
I think we can ask the program director to.
Oh, yes, is he here?
Dr. Mujib Shah.
Dr. Mujib Shah, are you here?
Yes.
Oh, I'm so sorry. Please, do you have any slides?
Since the beginning of the meeting. I don't have slides, but I can talk a little bit.
Yes, please do. I'm
actually moving. Yeah, I'm in the process of moving, so I could not prepare for this as well as I would have liked to. You want me to talk now?
Yes, please. It's so kind of you to come here and to attend this, and
Okay.
we are very honored and
Yeah.
privileged that you are attending this and give the
No,
students and residents some pointers.
yeah, most welcome. How much time do I have?
10 minutes.
Okay. Yeah, 10 minutes is not doing justice to the topic, but I think a lot of you have already touched on some very important points, which are going to be extremely important in being successful in getting a residency position. Since I'm a psychiatry program director, I would just like to give a little bit of data on how the psychiatry positions have been doing these days. Um, when I came to this country, psychiatry was not uh, 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 highly desired by the local, by the American graduates. But since that time, the interest in psychiatry has grown up so much that it has become quite competitive. And the numbers show that. So just to give you an idea, that among the top 5 programs which matched in 2020, uh, um, psychiatry was number 5, but the applications, total applications per position were the highest, which was 1.34 as compared to family medicine, which was 1.05, or internal medicine, which was 1.20. So you can see that the competitiveness in psychiatry has increased a lot. But that does not mean that you should be discouraged, because it may be challenging, but if that is something specialty you like, you should by all means should go for it. And we can discuss some of the things which you can do to optimize your application. So after that, let me go to some of the issues which might be highly relevant for the viewers at this time. I think I would like to discuss some of the factors which actually are extremely important in selecting applicants for the interview. Because let me tell you, there are 3 stages of an interview. One is before the interview, which is the application process, and also trying to find the programs which suits you, and picking the programs which you think you might be able to enter. There is another aspect of that which is during the interview, which a lot of other speakers have talked elaboratively. Um, I, because of the time, I may not be able to touch on them. But then there is a part which is the post-interview, factors, which I think Dr. Safdar actually very nicely said that sending a thank you note, a small thank you note, might be really may go a long way. So let's talk about the most important thing which I would like to talk about during this short time are the factors which results in selecting an applicant for interview. So I think it is absolutely right that the USMLE step 1 scores are the most important, is the most important factor. But that is not the end or beginning of the world, as I'll tell you, because the pre-interview factors, the secretary, the program coordinators in a residency program, they look at an application and they see a score, and they actually chop that application off if the scores are not fulfilling the requirement for their program. But at the same time, there are some borderline scores which will be picked, for later review. But then the other factors become very important. So you have to understand that USMLE score is important in the initial screening, but it is not the end or the beginning of the world. So that is very important point, because based on a survey of the programs, that which factors were important. So 91% of the surveyed programs actually said that USMLE step 1 was the most important. But in that group, there is another thing which was very important too, and we should always remember that the dean's letter. The dean's letter, which gives the synopsis of your performance in different rotations, which is also called MSPE, which stands for Medical School Performance Evaluation, may not be I don't know whether the international medical graduates, I'm sure they get some kind of letter. So but again, that is as important as the USMLE step 1, and they are both in the 90 more above 90% category. Then around 90% importance is the personal statement, and a lot of other speakers have talked about that how important that is. That should be honest, that should be realistic, that should and I think it's always a good idea to get it reviewed by multiple people, because the thing is that a different set of eyes may see different things, different problems, different issues. Also, I think it is an extremely important point to get it reviewed by somebody who has really good English grammar and knowledge, because this is not our mother language, and sometimes we struggle to write well. So I think those are very important things, because personal statement is around 90% important based on the survey. So I think in addition to USMLE step 1 and the medical school performance evaluation or the dean's letter, personal statement is as one of the topmost priority for you. Then around 84% importance based on the survey, the letter of references in the specialty which you are applying for. But that is another issue we can talk about at length, but I don't have time, so I'm not going to elaborate on that. Then within that 85%, you have SMLE step 2 scores, and then very important after that is your commitment to the specialty, because every program you are going to be interviewed with, they are going to emphasize whether you are genuinely interested in that specialty or not. For example, when I was interviewing, they really wanted to make sure that am I genuinely interested in psychiatry, or I'm just doing it because it is easily available comparatively than other fields. So this happens actually. So that is important. And then below that, after that, if you know somebody in the program, don't think that the contacts and the knowledge of the person in a certain program, knowing somebody is not important. It can be extremely important. So try to do that, which brings up the issue that when you are applying to the programs, I didn't have time to talk about where to apply, but maybe we can do that next time more elaboratively. I think one of the things you want to see is that to apply in a program where you see that they are welcoming international medical graduates. That is one of the most. There are many others too, but this is important. And so if there are international medical graduates, you can try to contact some of them and see how the program is, what are their priorities, what they would like to see in a candidate, what are their areas of strength, what kind of research the program does. So you can read the papers and you can impress them with your knowledge, that you know about the program, you're interested in it, and you would like to be in that program. So those are some of the things. And then how to overcome any failed attempts in USMLE, and also the gaps in your medical education. Those are extremely important. But as long as you have good USMLE scores and you cross the threshold for a certain program to accept you for a later review of your application, I think those things can be addressed relatively easily by building your CV, by building with abstracts, letters, case reports, reviews, anything you can enhance your CV. That become more important. You see, nothing is not important in this process. Everything plays a role to a certain extent. And then there are some programs. If you happen to be in a city in America, a lot of you may not be. You can actually go visit the program and say that I'm interested in this program, and I would like to do elective or a rotation there. And these people will get to know you. In this COVID-19 times, when there are going to be virtual interviews, it is very important for them to see you physically, because the physical presence of a person, the personality and the aura around a personality can be much more important than being interviewed on a laptop or a computer or a cell phone. So I think those are important things. Do I have more time, or is that all I can say?
No, please go ahead. I think this is very useful.
Yeah. And then there are some other factors which I was not able to discuss, which were actually were observed in another survey. Uh, 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 and some of those are that, there are some applications which are flagged by the NRMP for certain other reasons. I don't have to go in details about that, but that is something which is the highest impactful factor in terms of that survey, the second survey. And then there should be evidence of professionalism and ethics, which is the second important point came out in this survey. The visa status, especially for the IMGs, especially these days, I don't have to talk about that because all of you know that. Perceived interest in program comes back again in that survey, as I told you in the previous program survey, which I just talked about. And then the fluency of language. A lot of us, English is not our mother language, and sometimes we become anxious, and when we become anxious, we lose track of the words, and we use incorrect grammar. That does not leave a very good impression, especially in psychiatry, where the whole field is communicative. Um, and then grades in clerkship and the desired specialty is important. Leadership qualities, sometimes they may ask you questions that what is your leadership style, how would you like to, if you are given some people working under you, what is your approach, how you are going to do it. Please read about that on websites, and try to know a little bit about that, what are different leadership styles, and be able to answer that. So let me go to the uh, I think there are some important points during the interview, which I'll just to take 2 minutes to talk about, and then I'll leave it to other speakers. 90% plus importance based on the survey was interaction with the faculty during the interview, which is extremely important, and actually say that is like out of 5 point scale, it was 4.9. Unfortunately, that is limited now because of the COVID-19, but you do your best. You try to, you practice virtual interviewing, you do it with your friends, you do it with people who are doing residency and senior than you, and you practice, and that decreases your anxiety during the virtual interview, because that is an acquired skill now, and that will be extremely important based on what I just told you. Your interpersonal skills, your feedback from the feedback from the residents who are in that program, who interview you, is extremely important. Let me tell you, I just got somebody known to me into a residency where I was supervising residents recently, and I requested the residents to look for this candidate, and that candidate, there are multiple other factors, very smart, very intelligent, on top of everything, but I think the residents gave her a very high point and she was able to enter. So those are important things. Then the perceived commitment to come back again, because they want to see, are you really interested in the program, and so forth. So I'll end it here. If there are any questions, I'll be delighted to answer.
This is very good overview. Thank you so much for doing it. And one more thing, I think you will agree that it's also important to be courteous to the secretary who's scheduling your interview.
Absolutely, absolutely.
And to be courteous to the residents and the interns who are giving you an overview of the program.
You're absolutely right, because secretary is the first screening threshold you have to go through. And if you irritate that secretary, she is the total control at that time. Please don't do that.
Yes, thank you very much. So I'm going to ask Dr. Nasir if you have a few points, and if you want to give us your suggestions. Irfan, can you unmute him?
Yes, I think I'm unmuted. Finally, I'm allowed to be unmuted by Dr. Irfan. So a couple of things. I think, first of all, thank you very much, everyone. Mr. Ingram, Dr. Rizwan Naeem, Dr. Zina Safdar, Dr. Mujib Shad, Bilawal, Billy Ahmed, and not Irfan, and Nahwana Shafi, of course, to attend the meeting, and all the participants. Couple of points. I think all of those things that have been mentioned in the process have been already been talked about. As Dr. Shad was explaining, that although the scores are important, but also other issues like how you present yourself, how you communicate with the program secretary. And at times, these are very important things that get you into a residency program. I'm just going to share just one very true story so that all who are applying this year can understand how hard work and persistence can help. I was in AKU in 1997, and there was an intern with me, and she graduated and went to Saudi Arabia and worked there for 10 years, came here, did nothing for 10 years until she did her steps recently and applied for the residency last year. She called me, have her personal statement and her CV reviewed by me. And then she applied to about like 250 programs. She used to call all the programs. She used to wake up in the morning and call the 10 to 8 programs every day. And over the course of 1 month, got only one interview. She traveled, went for the interview, and she got matched in the program. She's, mashallah, now second-year resident in that program. And that is the story I want to share with all of you. So I think hard work and persistence always work. How you present yourself. Scores are important, yes. Year of graduation is important, yes. But at the same time, how humble you are and how good you are in connecting with people is also one of the most important factors. That's the one thing. The second thing about the virtual interview, Bilal was mentioning about, and Dr. Naeem has mentioned about, I did the phone interview 22 years ago for my fellowship. There was no such thing as Zoom at that time at 6 different hospitals from Pakistan. And at that time, it used to be the landline, and you have to buy that card and dial the punch-in number and everything, and buy a 1 hour of talk time and all that stuff. And although there was no personal connection or being ever seen in the program, I was able to persuade the program to give me a fellowship spot. Thankful to Dr. Rita Ryan in Buffalo, New York. And this is a true story. I never met that lady until I actually landed in Buffalo. I did not know who she was. I passed by her, and I did not know who she was until she introduced herself that I am Rita Ryan, and you were interviewed. And you have to remember, at that time, this technology was not that sophisticated. The websites were not that high class that you can access all the information. So those are the things that I just want to share with all of you. And I'm going to just mute myself and let Nahmana take over the session.
Hello, everyone. Thanks for being here. And just to introduce myself, I'm Dr. Nahmana Shafi. I am a pediatrician. I am director of pediatric clerkship in one of the California hospitals. So I work with medical students and residents. I'm a faculty at California University of Science and Medicine. And I am also mentor to medical students. And I have been mentoring students for JSMU for almost 10 years now, and actually longer in not a consistent capacity, but I was always available, and a lot of you know that. So first and foremost questions, since I have been doing it multiple sessions with you, especially on Facebook and Zoom over the last few years, especially JSMU students who are here, that make sure that you attend a lot of these sessions, because these, number one, are the virtual times. More you train yourself, you are better you are. Most of you will not have your videos going when we are here to help you, how you can make yourself better. Some of you will pick really weird pictures. Like I was doing this lecture and this student on the Zoom had a picture with his tongue thrusted out, a very weird, funny picture, which is extremely non-professional. So start being professional and participate in it. And know that due to COVID-19, lot of things and lot of timeline of different things and lot of flow of your exams and everything are going to be different. And know that you are not the only one. As I always say, it is students all over the world. Everyone is affected, okay? So know that this is your time. All of us have a different time to live. So this is your time and you just need to know what to do and be persistent. So I'm going to actually start with questions because I think that's the best way to know more. And I'm sorry.
Can we have a few minutes, Irfan, if he wants to say anything,
Sure,
just before the questions, if that's okay, Nahmana?
Okay.
Irfan?
Yeah, sure. Thank you so much. And I just want to focus on one thing, like most of the candidates who's applying for a residency, they're looking for some US experience. And definitely this is a very, very important thing to have in your CV. So my suggestion is like the people who already graduated, they have only option to do the observership, and that is only they can get it by the networking. So as Dr. Bilal says, networking, networking, and networking. So this is only, we all team members gonna be helped. You can like contact us, and also on your basis, like all the contacts you have, you need to utilize that to get some US clinical experience. Number two is the pupil, the student who already currently medical student. I don't know you are aware of not, they also have options to do the elective rotation in different university programs. So I would suggest like Google it and find out who are offering the clinical, like fourth year or final year students. They can get easily these elective, like Johns Hopkins, they have a program. So you just need to contact to the program coordinator, not the residency program coordinator, the elective, the rotation coordinators, and email them, and you can get it. They're gonna hooked up with one of the attending, and you can have ability to do the research and some clinical like rotations. So I think this is the option while you are a medical student. So this is an official rotation. So I will say if you're still medical student, so this is a great opportunity to do this elective rotation with the universities in USA. Thank you.
And one thing I would just add is that in Pakistan, we always call people by their first name. So, people will in Pakistan will call me Dr. Zinat, but over here, nobody will ever call me Dr. Zinat. They will always call me by my last name. So that's the normal culture. So always remember, always address whoever you're talking to by their last name. I think just a point. Yes, go ahead, Nahmana, please.
Yes, I have a lot of questions, so I'm going to kind of go in the order, and I would, if I can answer a question, I will answer it, and a lot of questions are actually for the speaker, so I will give it to the speaker. So Liz, actually the most important question which I have for you is, due to COVID-19, as exams are getting delayed and scores are they come a little bit later, some of them will get their scores much later than expected. So what will be your recommendation for their planning for the timeline? Like if they are planning to take exams, let's assume in 2021, should they look at the match at 2022 or 2023?
Can you unmute her, please?
There we go.
I think yes.
She's unmuted now.
Right person to answer some of this.
So I'll just give a quick response and then let everybody else chime in. The opening of ERAS, as was noted before, is later this year for program directors by quite a bit. So that gives a little more time for an application to look more complete at the first time that you download it. Of course, it really is the rank order list deadline, which also is late this year, March 3rd, 2021, by which IMGs must have met all exam requirements for Ecfmg certification. That is step 1, step 2 CK, and either step 2 CS or one of the pathways. And so I know that the situation is difficult and has been very difficult. So I would just have folks be diligent about trying to reschedule their examinations sooner if they can. Travel if that's comfortable, if they're comfortable doing that, and if that's something that they can do. Otherwise, it may be necessary to think about a future match, future than 2021. Thank you.
Okay, so the second question, which I'm getting a lot of those, are about electives. during medical school and the timeline which Dr. Bilawal went over. We all know that medical schools are closed, so it's just not possible to do that. Since there was like almost a 7 or 8 months where students were not at medical school, the timeline which worked in the past might not work. So be flexible. If you want to take your steps whenever you can, it's perfectly all right. I do recommend keep preparing for whatever your goal is. And when opportunity comes, go ahead and take your exam as quickly as possible. But it is okay if you are late in taking your exam, everyone else is as well. So be flexible with your exam. So that was answer to one of the questions. And then the one which I have, give me 1 second, I just need to go back to that question. Okay, so the question is that it is actually for Dr. Mujib Shad. Dr. Shad, are you there? Okay.
Yes,
How is step 1 pass or fail results, and only step 2 score is going to affect the resident applications?
So I assume that the question was relating to the past attempts fail, right? In the past,
The step 1 is going to be pass and fail. So from now on, so it's only going to be
I
step
understand.
2
Yeah.
TK score which you have, and no CS either. So this is what the new group will have.
Yeah. So basically, I think like everything else in life, there are pros and cons of that change. So for international medical graduates, the positive thing will be that the screening process will involve probably other factors will become more relevant than the score if you have passed the USMLE. So that would be my. But since we have not gone through that process, we cannot be sure that whether how that is going to turn out and how that is going to be treated. But in my opinion, I think since there was a cutoff, different programs have different cutoffs based on their reputation and their popularity. But now, since there is a pass and fail, all those who pass may be screened by programs. So that something will I think is positive, at least for the IMGs. But for the residents who actually shine and get very high score, it's a negative, because then they are going to be screened based on the same crude measure of pass and fail, and eventually the scores will be seen by the programs, but at least in the beginning they will feel, oh, all the hard work they put in, all the things they did, and all the good scores they got, it is not making a difference in being called for an interview, but eventually it will, I think, make a difference. So those are some couple of thoughts.
Okay, thank you, Dr. Shad. Dr. Naeem, this question is actually for you. You mentioned during your presentation that social media is very important for a candidate as well. So can you elaborate on the use of Facebook, Twitter, and other social media platforms?
So the point I wanted to mention is that with every program almost, and Dr. Shad can concur with that when they are interested in a resident, they want to do a background search. And one of the background search is social media. So you, as Nagmana was saying, that having a funny picture on your Facebook or something, some joke which is below standard or things like that, you should not have on social media. This your social media, actually Facebook and LinkedIn and so on, is your profile. They are looking at it. So my suggestion was to be very careful about what you write and what you post on your social media, because people are looking at it.
Okay, thank you, Dr. Naeem. There was another question about the timeline of graduations of medical schools. So most medical graduates who are expected to graduate from different medical schools all over the world, their date of graduation has changed. And this is something which has happened to almost everyone. So you have to plan accordingly. I always tell students that always have 2 or 3 plans, plan A, your plan B, your plan C. So if one doesn't work, you have another option to look at. And I would like to Dr. Safdar take the second question. The question was about where the recording of this program and all other future presentations and upcoming webinars could be found.
We're going to post it on Facebook page of JSIM. So if you go to JSIM on Facebook, you'll be able to find it. We are collecting the email addresses. So if you send us the email address, we will be able to send you the link.
And we will, Zina, should also have it on our website.
Yes, we will also have it on the website. We will have the link on the website also, which I'm going to post right now in the chat column.
And there is also a JSIM faculty students mentoring page, which I do check on a regular basis. And we had a lot of presentations through there, not only for United States, but other countries as well. I always ask students to post their questions. If you want to, we are here to help you, but know that it is a two-way process. So more questions you are going to ask and request what you want. It helps us to come up with a program. So please be proactive and ask more questions and from your end as well. Now, I also have a question about virtual electives. As far as I know about current electives, the programs which were offered through VISLO by Association of American Medical School, AMC. It's not actually active in most of the hospitals, I know, because we're trying to limit the number of medical students due to social distancing. So I would ask any one of my colleagues if they're aware of any virtual electives.
So, right, so I wanted to add to that, Mana, that virtual rotations, many hospitals and places have started virtual rotations also. And APNA, as a matter of fact, if you go to APNA website and APNA Merit, they have recently started a family medicine virtual rotation. And what it means really that you will log in regularly on a certain web page or certain site and be part of the conferences or lectures, and you will be program director actually or administration of that website can give you some type of certification or acknowledgement that you attended that virtual rotations. So we at JSIM should also think about it, and it's something very helpful for this era, which is not going to end till next cycle of interviewees. So virtual, Mujibuddin Shah, if you have any thoughts about virtual rotations, please share.
Yeah, I think I don't have any thoughts about virtual interviews, but I do have an important point to make, which may be extremely useful for the attendees, is that we have a Pakistani American Psychiatrists Association in North America, which we call as PAPANA, is the abbreviation. Easy to remember. It's a very unusual name, but I think that's why we put it so you can remember it. So PAPANA actually has webinars and discussions about how to apply in psychiatry residency, which might be useful and applicable for so many different other programs, but especially those who are interested in applying in psychiatry may really benefit from that. It's a very active website, and we have post personal statement, how to do CV, how to prepare for interview, and I have participated in some of those webinars. So I will send the link to Dr. Safdar so that she can put it on the JSIM on our website.
That would be great. Thank you. We'll do that.
Okay. So there's another question about personal statements. So I will let Dr. Actually, I would like one of the younger graduates and then program director to comment on it, because so Dr. Rashid and Dr. Ahmed, if you can kind of talk a little bit about what you would recommend to write in personal statement. Someone is asking a question, how much personal you should go and how much like different hobbies can contribute. So the question was, I'm interested in cooking. So if I kind of combine cooking with my interest in medicine, how it is going to look. And then I also had a question that I have that 18-month gap in my medical education due to a divorce which I went through. So is it okay to mention it in my personal statement? So Dr. Rashid and Dr. Ahmed and Dr. Shad then.
Well, so I would say I reviewed in the last 2 years about probably 50 personal statements. And each one has their own story that they want to bring into the discussion. I think there's no harm in bringing the true fact of, like the unfortunate event of the life that a divorce. Definitely, it's okay to bring it in the personal statement. And I think cooking is absolutely fine. I don't know exactly how you want to bring it in your passion to medicine. It's the wording of how you put it is very important. I had read a personal statement which sounds more poetic, and I had to correct that person about that you don't want, you are not participating in a poetry competition, and it has to be more related to medicine. So I think cooking is fine as long as you can relate it to your passion with medicine. Bilawal, go ahead.
So if Bilawal is coming back, so I would say that personal statement, there is a reason they're calling it a personal statement. It has to come from your heart and your experience. Do not, I will repeat it again, cut and paste from any other personal statement you find on websites or Google it or your friends even, because there are software programs which now programs are looking into is how you can check for plagiarism. Plagiarism is a crime, and it can be a very negative effect on you. So what it means that many people, if you see a good statement, you can get some tips out of it, but never ever do cut and paste type of it. I have seen it, and those people, if we find out, is even a one paragraph of your personal statement is plagiarized, we will not interview you.
And there are programs that you can run automatically to find out.
That's what I was saying. The software program, you put that statement in the software program, it will give you that if this has been seen before or not.
Yes, Bilawal, I think we have to unmute him. Must be some connectivity issues.
I don't see Bilawal on the screen.
I don't see him. Okay, I will let Dr. Shad kind of tell us about these personal statements.
This is a whole webinar by itself. So we may not be able to do justice in 5 seconds, but very briefly, I completely agree with Dr. Rizwan Naeem that look at the word personal statement. Personal is first, right? It has to be personal. But by the beauty of personal statement is that how do you use your life experiences in a positive way so that the interviewers and the people who are interviewing you, the faculty, actually sees you as a resilient person, that you have gone through a lot and you have gained so many life experiences and you sustained. For example, I had a candidate one time in the interview who actually very plainly wrote that he 3 years back, before entering the medical school, he was actually was using drugs, and the way he overcome that and the way he got excellent numbers in USMLE and scores was very impressive. But do it very cautiously. You don't want to be blunt. You don't want to be dishonest. You don't want to portray yourself as a Superman. You're very realistic, be very honest, but use your life experiences positively, because they are your strength. That makes you a person. That's personal statement. Thank you.
Thank you, Dr. Shad. Liz, I have a question for you. Please, does Ecfmg has a list of program directors at its website?
I don't know about Ecfmg, but there is a residency accreditation council which is called ACGME. They have all the program directors on their website. It's called American Clinical Graduate Medical Education. Council for Graduate Medical Education, ACGME, and that website can be very helpful.
Okay, thank you, Dr. Shad. Liz, another question is that all these gaps in medical education in all these graduates, how it is going to affect their Ecfmg certification and all these, like if they did any virtual rotations as electives?
Is this for me,
No,
Dr.
this is for Liz.
Okay.
So anything that is required for an individual to get the final medical school diploma, certain kinds of rotations. If there is a delay in that and there's a delay in getting the final medical school diploma, that will affect Ecfmg certification. We've talked a lot about examinations, the importance of examinations, but there's another component to the requirements for Ecfmg certification, and that is primary source verification of 2 core medical education credentials, and that is the final medical diploma and the final medical school transcript. So if there are interruptions in education that prevent one from getting one of those documents, there will be a delay in Ecfmg certification because we need to primary source verify those documents before a certificate is issued.
Okay, I have a question about experience in Pakistan and the experience in ICU or wherever you worked in Pakistan. Yes, it counts in your CV and it counts the experience, whatever, how it shaped you, it counts in your personal statement. Doesn't matter in which part of the world you did that medical training or work. The second question was that how JSU, or actually SM Medical College graduates are identified in the United States. I think we are identified as good physicians. So yes, we have worked hard to make a good reputation for our medical school. So that was one of the questions. I will let Dr. Safdar take over from here because I pretty much went over the overview of the questions which were asked, and a lot of things which you are asking, we will try to get like a separate program for that. And I see Dr. Bilawal. So can you?
I think I can just. Sorry,
Yeah.
I was kind of had to go outside. So the only thing I would share with a personal statement is when you apply, you have your AMC application. It has all your contributions about your research, about your volunteer experience, about your everything. Please don't repeat that in the personal statement because that has to be a story that what brought you in the field of medicine, like maybe your first rotation in Jinnah Hospital and how you wanted to just change your mind or whatever. I mean, it could be an undergraduate story. So a story, starting with a story and then just ending with a story versus repeating that, hey, you did your 4th year electives and then you did your publication. I mean, you can highlight those things in a subtle way, but please don't have your achievements just repeating yourself because they already have it, and repeating that thing again might not help you versus just coming as a person that who loves medicine, who wants to do this or internal medicine or psychiatry or oncology or cardiology, and why you wanted to do this, what made you do this, and that personal story should relate. And I think that will go a long way. The second is the program directors. You have FRIEDA, which is an AMA website, FRIEADA. I think you might need to register for it, and you can search for every program director and coordinator. They update the list. So, but I think it's a good idea that I think we should, as a group, we should organize the list of Pakistani program directors who are in position of any field. And I think that would be a great idea to do that. Thank you.
So
Thank you, Dr. Ahmed.
I wanted to add something for this continuation of what Bilal has said, that just looking for Pakistani graduate actually only 0.5% of the program director. So you look for every program director who you can approach, as Nasir's experience was also. You just do not look for program directors, because that limit your chances tremendously. You may feel more comfortable with that, but that's actually might hurt you.
Okay, I have a question about observership after graduating from medical school, which is different from doing electives while you're still in medical school. So I will let Dr. Safdar ask that question and then wrap up the meeting.
Right. So there's a question coming up, right, about the observership. So you can do an observership after you graduate. It's always good to start doing an elective while you're a medical student because it's easier to get. There are people who are looking for elective and observership at this point in time where the hospitals are not allowing outside physicians or students to come in. I would say if you can get an observership in any clinic, in the outlying clinic, in any area, I think it would be better to do that rather than not. There was another question about doing observership or volunteering or helping out in Pakistan. I think that's a very great idea. If you worked in the ER or anywhere else in Pakistan as a COVID frontline worker, that would look very good on your CV. You can share your experience there. You can put that in your personal statement. I think anything that you do is valuable. If anything that you have done to help patients and worked in that regard, I think you should put that in your CV. You should not undermine yourself. You should not limit yourself, and try to see if you can even work with the public health officials. You can work with any research is not going to go to waste. Any little work that you do, even if it's not published, even if you present it as an abstract as a medical student, that will go a long way when you apply for your residency postgrad position. Yes, Dr.
I have one last comment before we close it. I know that there are a lot of questions and a lot of issues. You may still have it, but I will direct Dr. Zeenat and group to all the students. Please connect with Dr. Nahmana Shafi because she's been doing medical student mentorship for years. Search for her. You will find her on website. She will help you if you're a medical student as how to approach forward. And if you are already past medical education and looking for residency, Dr. Nasir Rashid is one of the contact who will, this year we are also, Dr. Zeenat, with the help of Dr. Zeenat and Jason Yuana, we are helping one-on-one mentorship for a lot of people who can get into rotations and help in certain subspecialty. So keep your email active with Jason Yuana and keep looking for these new development hopefully this year.
Okay. I just want to share one thing. I think the important thing I want to mention is that there are at least about like 50 plus participants. And if any one of you are sending us an email, and especially me, I put my email plus also my WhatsApp number, so that when you're sending an email, please text me on WhatsApp with your brief description, who you are, so that I can retrieve your email from my spam or junk folder. Otherwise, it will go into my non-contact list. So please, when you send me an email, send me a short text about who you are when you send me the email, and I'll retrieve it, and then we'll try to reach out to each one of you.
Nasir, there are about 90 participants in this meeting.
Yes. Oh, thank you. Thank you.
Dr. Jamshed raised the hand. If Dr. Jamshed is still there, she can ask the question, and please turn on your video. Okay, I think she might be not here. Nakmana, go ahead.
So I think we should end it now. Now, Zeenat.
Yes. Thank you very much. I'd like to thank everybody for joining and having such a great discussion and such participation. This is really commendable. I would really like to thank Dr. Elizabeth Ingram, Miss Elizabeth Ingram, for joining and made her doctor, which is good. She comes to all of our webinars. I think she's entitled to that.
Yes.
And also Mujib Shad for giving us such great pointers. Dr. Rizwan Naeem, Irfan, Suleiman, Nagmana, Shafi has been doing mentoring for a long time, and she's a great resource for all of us. Nasir Rashid has done a great job. Bilawal Ahmed, all of you who have really put forward a great program, really appreciate it. Thank you so much.
Thank you so much.
So Irfan, before you hang up, thank you very much. Irfan, we need the list of the emails.
List of the
Can you hear me? The emails that come on the chat. Can we have that list of the emails?
Are you able to download it?
Okay, I will try. Okay, sure.
Yeah, I'm actually taking the screenshots, but at the same time, if we can have all those emails, that would be great. Thank you.
Thank you.
Thank you.
Thank you very much.